Hey everyone, Dr. Kuniak here with a mid-cycle supplemental video lecture. So one of the things that I wanted to talk about, and I thought might fit well in one of these supplemental lectures, was what role our theoretical orientation plays in the counseling process. Because we've talked a little bit about how assessment should lead to good treatment planning, and good treatment planning should lead to good treatment. I've shown you how I work through a vignette, and so a counseling case study, and how that um, makes sense to me, and you all helped with that. And then we looked at how you would write a note about a session related to that, and how that note links to the treatment plan, and how the treatment plan should drive treatment. We've looked at all of that already. So, but at the beginning of this semester, I had made the statement, and it says in the syllabus, pull back out your theories textbooks. And I had told you that my suggestion would be not to follow necessarily the suggested readings of the course, but rather to dig into the textbook and read from the theories that you most align with to get you prepared to do your sessions with your clients. So with that all in mind, it got me thinking that maybe we should have another conversation about what role a theoretical orientation has with the work with our clients. I think the other thing that I was really thinking about, it's late as I'm recording this. The other thing that came to mind for me is I had a handful of questions with the informed consent forms where folks were asking, or were making statements about how you do the work that you do, and I think many of you did that beautifully. But my suggestion was to spell out a little bit more about your theoretical orientation. So if you mentioned, person-centered approach, just say what that means. So a person-centered approach, what's a hallmark of it is really focused on the client being the expert in the change process, that they have everything that they need in order to make change, and the role of the counselor is really to just be reflective and help the client to make sense of all of that. You could speak about unconditional positive regard being a hallmark of the orientation. There's a lot of ways that you could capture kind of the spirit of what the theoretical orientation is. I know our volunteers are art therapy students, and they've probably had, I don't know the whole curriculum in the program, but I presume that they've had some connection to theories of counseling at some level, but they probably don't have as much theoretical knowledge as you all do, and they have probably not been exposed to it at the level with which our KCREP accredited programs expose students to it. Now, I know you may have kind of moved on from your theories talk, as is typical. There's always a little bit of drift. That's normal. But you've still been exposed to it more, and so you can still kind of touch back on this stuff. And so I think that that's really good practice for, so you're practicing explaining it to art therapy students who are your practice volunteers. You're going to have to at some point explain your orientation and your approach to your clients. They may not care what it means to be person-centered, or what it means to be a Gestalt practitioner, or what it means to be, to focus in on rational emotive behavioral therapy, or whatever the case may be. They're going to need you to explain that a little bit more for them to understand how it is you think about this field. Some clients may never ask you and may never really be concerned, but there will be clients who are. And so because of that, and because I think it's important to have a good sense of our identity and how it is we do the work that we do, I think it's important to practice sharing that with someone else. It does not have to be significantly detailed. You don't have to do a dissertation on it. You just have to be able to kind of explain to someone so they can say, like, oh, okay, that makes sense. Now I understand how you think about change, and how people do the things they do, and where they get stuck, and how they get out of it. So I think one of the things that really comes to mind for me is that theoretical orientations help us to orient ourselves to the field, help us to think about and conceptualize how clients get themselves into trouble and how they get themselves out, kind of all this stuff that I just described. But it also helps us when the going gets tough. So it may be one thing to work in a setting where, the client comes in and they tell you about everything that's happened since the last session, and you kind of go by the seat of your pants and you know just reflect back to them and kind of problem solve with them and everything. But that's not going to get you through the deep stuff. It'll help you problem solve, but it's not going to get you. That's first order change. It's not going to get you to second order change, which is the really lasting change. Theoretical orientations help us to get there. It helps us to kind of figure out what all of this means for the client. And so, too, when the going gets really tough and a client throws you a curveball and you're dealing with something that you've never dealt with before, you can go back in your mind to what would Salvador Minuchin say about this? Or what would Carl Rogers say about this? Like, what did they think about when a client said this stuff? Or what's an intervention that they would use typically? You can pull on that and just try it and see if it works. It is shocking to me the number of times that I have not believed in the earlier part of my career, because I've learned my lesson. It's shocking to me the number of times that I have believed that there's no way that that intervention will work the way that they're describing it, or that's a 1 in 100 chance. You need the right client and the right circumstances in order for that to play out. But I've not had anything else to do. Like, I've been painted into a corner, and I thought, that's the only thing that's coming to mind. I'm going to try it. And then it's worked. And I've been shocked. And so now I get it, that these interventions really do work. So it's important for us to know how to do them well, and why they work, like what the intention was behind doing them. So a theoretical orientation helps to guide us in the good times, and it really helps to save us and be an anchor point in the difficult times. And I mentioned very briefly the idea of drift, and drift is something that happens a lot of times after we get out of our counseling programs, because certain agencies and practices that we're going to be finding jobs at, that I found a job at, jobs, because I moved around a little bit, they're going to be oriented towards a very specific way of providing practice. It may be related to the way in which their funding is laid out. It may be related to what is kind of the evidence-based practice associated with what it is that they're treating. It may just be that this is what the executive director particularly likes. And then they may leave it up to you, and you're stuck trying to work with clients who maybe don't want to do this or maybe don't know what they're doing, and so you pull upon supervisors who are working in that program, and they give you feedback that has nothing to do with theoretical orientations, because they've been out of school for 20 or 30 years and they don't remember any of the theories anymore. They just know what's worked for them year after year after year, and that's what they do. So drift happens. It's very common to find ourselves in practices where nobody really would be able to tell you what their theoretical orientation is, because they just do what they need to get done. And that can work, but it's not a great way to do it, in my opinion. I mentioned that they may, and you may already know this, but agencies and practices related to their funding systems may be required to use a certain theoretical style. Like, it's very common in drug and alcohol counseling to use CBT, cognitive behavioral therapy. That's an evidence-based practice that a lot of the courts prefer. A lot of the insurance companies prefer it because behavior is easy to manage, so they can have you submit your treatment plans, and you'll know when you complete things because the behavior is observable, and as soon as it's observed, the goals are completed and they shut off treatment. So CBT is very popular and it works. I mean, if you think about addiction, substance abuse, changing thinking in order to change behavior makes total sense. But there's other approaches that work too. But I worked in drug and alcohol counseling, and they only wanted me to document things and do things from a CBT perspective. They didn't care that I had a really cool Gestalt technique that I wanted to try with this client that I thought would work really well. I could do it, but I had to figure out how to write it up as though it was CBT in my note. And there's overlap. There are interventions that you can use. I don't identify as being a solution-focused brief theorist at all, but I use a lot of solution-focused brief interventions. I use scaling questions all the time. I use the miracle question quite a lot. I love it. I think it's a great intervention. But at the core of the belief system of a solution-focused brief therapist, that doesn't align with my beliefs on how counseling ought to be done. It's not wrong. There's nothing wrong about their orientation or folks who really align with SFBT. It's just not how I think about it. And so I align better with an existential framework. And Gestalt works really well for me. And I really like structural family therapy, and I really like narrative therapy. Those things fit with how I think about change. So those are my orientations. But I still pull from other interventions to work, and I can still explain an intervention using other theoretical orientation models. For example, in family based, everything had to be looked at through the structural family therapy lens. You couldn't use strategic family therapy. The state, how they wrote up the program and offered the licenses to the agencies to practice family based counseling, and if they wanted to be reimbursed, it all had to be through the language of structural family therapy. They actually also required, the state required, that if we were to receive funding working at a family based program, you had to go to a state approved family based training program so that folks who came and worked for the agency were all learning the same stuff. So you learned interventions for structural family therapy. If you completed 3 years of it, you got an additional certification in structural family therapy. I have that because I worked at that for quite a while. But so everything we did had to be interpreted using language from structural family therapy. So we talked a lot about circular questioning and enactments and sculpting techniques and all that. I'm drawing a blank on some of it. I would use other interventions, but I would have to talk about it through the lens of structural family therapy. So anyway, this is why drift happens, because we're pulled different ways by the realities of the work that we do. But that doesn't mean you have to lose focus on your theoretical orientations. It doesn't mean that you can't be attracted to and aligned with what really works for you. So I very much encourage you to think about what this change process looks like, and I very much encourage you to try it and see if it fits. And if it doesn't, that's fine. You can change after that. Maybe in our next live meeting, we can do a little bit more talking about theory of change and how you want to apply that to your clients. But that's why we still focus on theories, because theories help to guide us. Theories help to, help us through the times that are tough. Theories help to keep us on track and really really help us to speak to what we believe that change process is and why we believe it's going to be helpful to our clients. So hope this was helpful. Hope it all made sense. And I will look forward to seeing you all in the live meeting coming up. Take care and have a great night.